I'm Martin de Villiers. I'm from the Independent Clinical Oncology Network, or ICON, who represents the oncology fraternity in South Africa. The topic of discussion would be disruptive innovation and using the concept to demonstrate how a group of doctor leaders reimagined and redesigned the way clinical risk is managed in oncology very specifically. And they came up with a solution which is evolutionary and continuing over the past few years that really disrupted the industry. And disruption in the sense that it's new and it really improves aspects of quality of care that hasn't been addressed over the past 20 years. And that's really the context of the talk, that there's a lack of quality that we're trying to put back in clinical risk management. So why disruptive? And it may sound very funny, but it's disruptive because it places the patient at the center of change, which is very important. So has the patient not been at center? And unfortunately, the dynamics within the industry drove the patient away and was very much more focused on a doctor-centric and a hospital-centric. So it places the patient in the center of the solution with better benefits, better access to care in oncology. Secondly, it disrupted the business model. So instead of having a third-party managed care organization dictating cancer care, the solution was developed by doctor groups. They use it, and therefore the solution is negotiated with medical schemes with whom ICON forges a very good relationship on a continuing basis, which is very different from where we have a chasm between funders and providers of care. Thirdly, the solution is really technology enabled, with the technology capturing the intelligence that was developed in treating cancer care, but also bringing about efficiency gains through the system. And fourthly, it creates value. It creates value for funders where there's efficiency gains. It creates value for patients where the relationship between the medical scheme and ICON resulted in better benefits and more appropriate benefits for cancer care for patients. And then lastly, for the oncologist who's less frustrated with the whole process of trying to engage with medical schemes through managed care organizations, getting treatment plans approved. So really value is created across the whole system. So what is the purpose of the talk then in the end? Is really to inspire leaders within the industry to create and to reimagine a future healthcare system within the private sector that can come up with new efficiency gains and with new aspects of quality of care.